So what are the best sources of alternative revenue for your medical practice? With insurance becoming more difficult to deal with every day, it seems like, and reimbursements dropping, I think we're down almost 30% over the past 25 years for the Medicare reimbursement amounts. And it's becoming increasingly more important that you look for alternative sources of revenue for your practice. And the question I get asked often is, what is your best source of alternative revenue? There are plenty of things you've heard you can do as a doctor, many of which you never even thought about. You thought that just seeing patients would be all you ever needed to do. But the reality is that if you have your own practice, you do have to start thinking about alternative ways to generate income. And I would say by far the most lucrative across the board is getting into medical legal work. Now, what does that entail? Well, it could be as simple as just doing document reviews for attorneys. Basically, you would contact a law firm, and a lot of times you'll know attorneys in town or have worked on cases, either treated patients that are represented by an attorney, and they will potentially reach out to you and say, hey, I've got this case. I don't really understand the nature of this injury or these damages or this medical condition, and you can charge an hourly rate for your services. And that rate can vary depending on where you practice, what city, and the legal climate, but it can go from anywhere to $300 an hour to $600 an hour. And if you're doing something like a formal deposition, I've seen rates go anywhere from $2,000 an hour up to $3,000 for an hour-long deposition. So document review for an attorney is a good way to kind of get your feet wet if you do want to start doing some sort of medical legal work. They can also potentially ask you to do either independent medical exams or IMEs or second medical opinions, which are basically the same thing, but when they come from the defense, it's usually considered a second medical opinion. And those are basically just detailed history and physicals where instead of administering treatment, you basically just evaluate the patient, see what they've had done. Sometimes they'll want you to determine causality if it's an independent medical exam to see what caused their damages. Was it this accident, or was it something else, or was it a pre-existing condition? Those are all things that are important in the legal climate for the attorneys to determine the value of the case and if there is a legitimate claim or if it's a bogus lawsuit. So that can be very helpful for attorneys, for you to be able to give your expert opinion. And that, to me, is probably overall the best source of alternative revenue, certainly for certain specialties that involve a lot of injuries, spine, back, neck. And you don't have to be an orthopedic surgeon to do those. You can be a primary care doctor. You can be a pain management doctor. You could be a neurosurgeon. It really varies. So that is a good source. And and once you're kind of comfortable with that, you might be asked to be an expert witness. Expert witness involves a little more know-how of the legal system, and you are going to be sort of an advisor to the defense team as to how legitimate the plaintiff's claims are, and what you actually think the true damages should be, or give them advice as to how debilitating their injuries are going to be for their future, to help them develop what's called a life care plan. And that's something you'll learn about as well. The life care plan will be a basically map for the rest of this person's life regarding that specific injury. If they have a back injury, it might entail the potential cost of a lifelong regimen of pain medication or physical therapy or repeat MRIs, or even something like a spinal cord stimulator. So that's a very good path if you do want to consider doing an alternative to just seeing patients. The other thing, people always ask me about these medical opinions is, how much time do they take? Well, at first it may take a little extra time just because you're kind of learning the legalese, what phrases you want to say. Typically, you do want to say from a legal standpoint, something is more likely than not the cause of something else. It just has to be greater than 50%, at least where I practice in Louisiana. And that's kind of the terminology you want to start to utilize in these independent medical exams or second medical opinions. Again, the rates can vary, and these are negotiable. When you're just starting out, I would start out on the lower end of the price spectrum. And then as you get more seasoned and you're comfortable doing it, get more sought after, you can raise your rates as anyone would who becomes more of a specialist in a field. So that to me is a good side job, basically, if needed, if you feel you're wanting to become less reliant on insurance company reimbursements, which just seem to continue to go down, and I think they're going to continue to go down for years to come. One of the ways to get started, people always ask, how do I get started? Again, you may already know some attorneys in town, plaintiff and defense, and I would actually try to do both. It actually makes you more legitimate as a witness in general if you do both plaintiff and defense work. And your goal, and this is always my goal, should be just to get to the truth. You don't really want to play sides. You really just want to give the court the honest opinion that you have come to based on your years of medical training. So they like an accurate assessment that gets to the truth. And if you do that, you will have more success overall in doing this, and you'll be more helpful to the court system by just saying exactly what you think. So that's sort of how it gets started. One thing you can do, if you already have an advertising person in your office that goes out and hands out cards and does lunches on your behalf for advertising for your practice, that is something you can do with some of the bigger law firms in town. And you can just look at billboards, look at what pops up on commercials. I went and met with some of these law firms and told them what my specialty was, and how I potentially could be useful, and how long I would typically take to turn over a report. That's very important at the beginning. I think you want to be able to do these reports and deliver a high quality product so that they can use it to determine exactly what the damages are, the causality of these damages, and the true value of this case, because ultimately they're just trying to figure out whether this is something that should be settled for a certain amount, or if it's a claim that one side feels is not legitimate. Usually the defense may feel it's not legitimate in certain circumstances. They may want to pursue it, and sometimes they'll go to trial. It usually ends up getting settled. I would say for the most part, from a legal standpoint, they'll see a doctor, at least the plaintiff side will have a doctor see the patient, and sometimes it gets settled just based on that initial doctor's notes and what treatment's rendered. Other times it can progress to where you have the defense wants to have their own experts, and you can even be that expert. If it reaches a point where it goes to trial, they will want an expert witness, and sometimes you can be the expert witness, or sometimes they'll have another doctor be an expert witness, depending on the nature of the trial. But those are ways you can get involved. And if you do end up doing expert witness work and going to a trial, your typical charge would be roughly what you would generate in revenue on a day if you're a surgeon in the operating room or seeing patients in clinic. And that's usually what your charge is. I can tell you I've seen rates go from $4,000 a day in court to $10,000 or more, just depending on the nature of your practice. Those are ways that you can definitely, first of all, help the legal system get through some of these complex cases that, otherwise they wouldn't be able to determine, what does this patient need going forward for life? Do they need a spinal cord stimulator for their intractable pain? Do they need physical therapy or medication for life? You're helping the court do that. And so you are doing a service. So if I could pick one alternative source of revenue to consider, I would start with medical legal work, again, depending on what specialty you're in.